Hi, everybody. If you can't hear, let me know. I'll talk louder. Welcome. I thought there's so much about rabbit medicine that you can only talk about little bits at a time. But today we thought we'd focus on the urinary tract. So, I guess my first task is going to be to give you a little overview, reminder of what the urinary tract is. So, that's it. There it is. Urinary tract, okay? Kidney at the top collects blood, turns it into urine. Ureter, small thin tube that leads the urine from the kidney down to the bladder. Bladder collects the urine, stores the urine, expels the urine. And the urine comes out through the small muscular tube called the urethra. Bladder, ureter, you never hear about those, they're kind of hidden. Bladder, kidney, ureter, bladder, urethra. The urethra empties in boys pretty obviously through the penis, that's easy to see. In girls, it comes out through the vaginal opening. So the opening down here varies by the sex, okay? So, what do kidneys do? Kidneys take a lot of blood and filter it, removing waste product, sending the waste product into urine down to the bladder. They remove excess calcium from the blood in rabbits, not in all species, but in rabbits. They conserve water when needed, so that means they'll take a lot of blood, put all the waste out, and take the water back into the bloodstream if you need it. Or if you're drinking more than you need, they excrete the excess water. They also produce some hormones. We're not going to worry about those today. So kidneys take the blood, filter the waste products from the blood, especially those generated by protein metabolism, filter excess calcium, and either add water to the urine if you have too much, or take water out of the urine and conserve it if you don't have very much, and send it down the ureter. The ureter is just a tube, leads from the bladder, the kidney to the bladder. The bladder is not just a big bag. The bladder receives and stores urine from the kidneys, but it also has an active role in urination. The bladder is a muscle in the wall that needs to squeeze when you urinate, so that bladder muscle is active in urination. There's also a sphincter, a muscular valve down here that keeps you from dribbling all the time. So the bladder holds the urine in until it's ready to go and then pushes it out when you're ready to pee. The urethra is a tube, but it's a muscular tube. It can contract, it can spasm if it's sore, and it also has some control over urination by a valve at the lower end. In boys, in girls, the urethra is pretty short and fat. It just leads right out. In boys, it has to lead from the bladder all the way out through the penis. So it's long and thin, more likely to have trouble in a urethra in a boy because it's a long, thin tube. All right. So that's your basic anatomy. Any questions about basics? Yes.
Does the neutering age have any effect on potential problems in the male later in life? That if they're neutered early?
Urine what?
When they're neutered early and that tube is still small, does the neutering affect how much it grows and how much trouble they'll have when they're older?
Good question. Probably coming over from cat medicine. There's some thought that when you neuter a boy early, that his urethra is going to be underdeveloped, penis is going to be smaller, the urethra is going to be smaller. Is that going to cause trouble later on and whether it gets plugged up? I'm pretty convinced that in rabbits it does not. The reason is the rabbit urethra is much more flexible than other species. I have seen a 2-pound neutered boy rabbit pass a 1 centimeter stone, so almost over a quarter of an inch came out of there. A cat can only pass a stone that's a 1/16 of an inch, so their urethras are dispensable even if they're neutered. Good question. Other questions? Okay, onward. We should also talk about the nervous system, because the nervous system drives all of this. The nervous system controls when the bladder muscle contracts, when the sphincter contracts, and when the rabbit postures to urinate. So that's really important. So the nerves. Nervous system guides that all. Okay. The next topic is called what, where, and cause. That's my little system for kind of defining problems within the urinary tract. And the reason I'm talking about this is to give you some tools to filter all the information you've had coming at you from the internet, from gossip, from newsletters, from breeders. How many of you have heard bits and pieces about the urinary tract that you're not sure of? Good. Name something you've heard that you're not sure if it's right. Vic.
Color of urine.
Color of urine, is that important? What does it mean? Anybody else? Sludge. What is sludge? I'm thinking of statements like, somebody will say, oh, my veterinarian treats sludge with sweet potatoes, or with, something. Okay. Those statements like, pellets cause stones. Don't feed kale, it causes stones. If you don't wash your produce, you're going to get a urinary tract infection. Overweight causes urinary tract infection. Those can be true, but it depends on what you're talking about. All infections are not the same, our stones are not the same, all rabbits are not the same. So what, where, cause is what I look at when I'm talking about a urinary problem. So what? What is the problem? What are we talking about? Example of a problem, blood in the urine. EPs, there's blood, that's your problem, blood in the urine. Another problem, straining to urinate. My bunny's got his tail up, he's posturing, he's squeezing, and he does that a lot. That's straining to urinate. That's a problem. What other problems are there? Yeah. Urine color is wrong. Color is too dark. Okay. Yeah. Urine scald, this bottom is all wet. Where'd that come from? Okay. So if I was to say, I treat dark urine with antibiotics, would that be right? Maybe, yeah, it depends on what. So now we need to know where in the urinary tract is the dark urine coming from. So where relates to kidney, ureter, bladder, urethra. So, okay, I have a rabbit, say, with blood in the urine. First thing, the question is that the right problem? Is it blood? Rick said, what about urine color? Have you ever seen red urine in your rabbits, anybody? Some of you. Can somebody describe what it looked like?
In my case, it was very dark orange.
Dark orange urine. So that's not really normal. Is it blood?
No, it was not blood.
In his case, it was not. I've seen red urine come out of rabbits, just bright red. My differential diagnosis for that is blood, eating beets, eating dark greens, or who knows what. So red urine doesn't mean blood, so if we think the problem is blood in the urine, then we want to confirm that with a test. If there's blood clots, that's pretty obvious. If there's no blood clots, then we look under the microscope or we do a dipstick and we make sure it's blood. So our problem is blood in the urine. Where is that urinating? Kidney, ureter, bladder, urethra, or in this case, genital tract, because females' genital tract drains into the bladder, so drains out with the urine. So you have to know where it is to know what it is to treat. So that's why we want to do tests. How can we find out where the problem is if we really have blood in the urine? First is physical exam. I look at the rabbit. If I feel the belly and I feel a big hard marble in the bladder, stone in the bladder, that's where the blood comes from. If I feel the kidneys are big and enlarged, well, maybe it's the kidneys. If I don't have any clues or we need more information, then we do what we call imaging. What's imaging?
MRI.
MRI, good. Imaging used to mean x-rays, because that's all we had was x-rays. So now, imaging means x-rays, ultrasound, MRI, CT scan, all of those. Sometimes x-rays are enough. Take an x-ray, you see a stone in the bladder, you go, stone in the bladder, we're okay. That's what we're going to work on. You take an x-ray and you see one huge enlarged kidney and another small kidney, at least you localize the problem. Now you have to work on what it is, but that's where. It's in the kidney or it's in the bladder. If that doesn't tell you the answer, you might need to do ultrasound or a blood test to look for infection, look for kidney failure, lots of things. So where is where you're testing your physical exam, you're testing your imaging, where in the urinary tract is the problem. Cause. Okay, so now I think I've got the problem localized. I have blood in the urine, and in this case, let's say it's unusual. Let's say he's got one really big kidney and the other one small, and I think, probably coming from the kidney. Then we have to know more about what's going on. Is the small kidney abnormal and bleeding, or is the big kidney abnormal and bleeding? And then you have to do more tests to figure it out. So the key to figuring these things out is knowing what is the problem, where in the urinary tract is it, and what is the cause. So if you hear that somebody treats stones by XYZ, giving prednisone or ivermectin or whatever, that isn't enough information to evaluate or to apply to your own rabbit. You at least have to know is, the problem is a stone, where is the stone? Is it in the kidney? Is it in the bladder? Is it in the urethra? Is it in the ureter? Or is it in the gallstones and has nothing to do with it? You know. So that will kind of help demystify why there's so much information out there that seems contradictory. They're not always talking about the same problem. So you have to pay attention to the details and ask questions if you don't get it the first time around. Okay, a couple examples. Bunny C came in and the problem was difficulty passing urine and pain. Physical exam, bingo. I didn't know where the problem was. I felt everything. I felt the kidneys, I felt the bladder, and feeling the urethra right where it's emptying out. Right when we get to the urethra, I can feel right through the skin there's a huge stone there. Okay, we got the problem. He can't pee because there's a stone in the urethra. Then we have to decide what caused it. Well, causes of urinary stones are many, and you have to do more testing to figure out. There's two questions. How do I get rid of the stone? And how do I prevent it from coming back? So here's another one, what, where. Bunny is just not doing right since spade 4 or 5 weeks ago. Hasn't been quite right, just hasn't been quite right. Physical exam, again, gives us a clue. One kidney is really big and the other one's small. Do a blood test, not in kidney failure. We can image this, we can biopsy this, we can do ultrasound, we can do an x-ray. We did an x-ray, no stone. We could do ultrasound. In this case, the bunny was in rescue, and they wanted to get an answer as soon as possible. We went right to surgery because we knew where the problem was. It was a kidney. At surgery, we found that the kidney had been physically damaged. Don't know how that happened. And urine was leaking into the sac around the kidney. So the kidney was not functioning. Remove the kidney and the bunny's okay. So one of those things, you have to know where, you have to know why, and you have to know the cause. In this case, it was a damaged kidney. Never figured out how it was damaged. Okay, so common problems. Anybody got a favorite urinary tract problem? Yeah?
I just had a rabbit who had very dark orange colored urine, and it occurred right after he got better from GI stasis.
Okay. Very dark orange colored urine. Is that a problem? Might be, might not be, don't know. Where would that come from? Might come from the kidney, because that's where the urine is formed and gets its color, so we want to know, are the kidneys working? It might come from the blood that's passing through the kidney, if that's dark orange colored, like in jaundice. Might come from dissolved blood in the urine, less likely. So you do a urinalysis, you do your physical exam, you do a blood test, and what did they find, Rick? Went away, huh? Died? Oh, sorry, yeah. So don't know for sure in that case. May have been significant with an internal organ. But again, dark orange urine, you can't say, oh, I know what's going on, I'll treat it this way, because you don't know. Any other favorite problems? Yes? Dribbling urine. Okay, that's a good one.
Hair bands. Oh my God, I love it. I love it. Get pictures.
Okay, where's the problem? We're dribbling urine. The bladder controls the urine mostly, the release of urine. So we're looking at the bladder and the ureter down here. So where is most likely bladder and ureter, but what is going on? What caused it? Don't know. The other possibility is nervous system, because that is what that works with the nerves there. So urine dribbling, urine leakage, urine soiling. I think of, for the where, flabby bladder muscle, bladder, weak sphincter muscle, weak nervous control of the sphincter. I don't even have it here. Musculoskeletal system, failure to posture. So instead of peeing, he's peeing. He's dribbling down. Okay. And sometimes hormone balance. It's more likely with actual urine marking, but a rabbit that's really, really excited about other rabbits around, they just dribble while he's hopping around. So those are all possibilities. So you have to go through and say, okay, is this rabbit obese? Can he posture okay? Does he have really, really sore hips or pelvis so he doesn't want to posture? How does his bladder feel to the veterinarian? Some bladders feel like a little water balloon, that's good. Some feel like a tennis ball, that's too thick and sore and not right. Some feel like a sack of beans, that's not right either. So if the bladder muscle is nice and toned and feels normal, then you look at the sphincter, you look at the nervous system, you look at the muscles. So treating urine scald or urine dribbling might range from treating arthritis to treating a flaccid bladder muscle, and you have to figure out then why. Is it a nervous problem? Is it because there's been infection in the past? Was the bladder stretched out? Was there a stone that made the bladder distend? Just have all these things. So urine dribbling is a good example of, you got to figure out which one of these. Is it amazing that not every workup costs $5,000? It answers all these questions. So what do we do? What do we do? Why don't we do this every time we come in, do every test we can do? Because it's not practical. Probably not fair to the bunny to poke them and x-ray them and CT them and do that for everything. So we look at how sick is the rabbit, how urgent is it to get an answer, and are there common answers? If I see a rabbit that is putting out bloody urine and I take an x-ray and there's no stones, then we haven't proved that there's an infection, but that's a good bet. Let's try treating for infection and see. Let's culture the urine, see what's growing. Is there infection, and go. If you come into me with your bunny that you just got from the shelter and you're on a shoestring budget and you don't know what to do next, we go through this whole list in our heads. Could this be a stone? Yes. Could it be a tumor? Yes. Could it be a giant kidney worm from Brazil? Yes. But what is it most likely? Most likely an infection. We're going to try the antibiotic, but keep in mind that all this other stuff could be going on. So that's where it goes. Okay, stones. I hear a lot about stones. Anybody had a bunny that had a kidney stone?
Oh yeah.
Kidney stones you'd have. How many had rabbits or know rabbits that had stones that you just know there were stones? You don't know where they were. Anybody? Okay. Bladder stones?
Oh yeah, definitely.
Good. You guys must be feeding your rabbits right. Okay.
I got them all.
Yep. So, kidney stones and bladder stones. Stones in the kidney, stones in the ureter, stones in the bladder are all different. Stones in the bladder are uncomfortable. They can occasionally plug up the bladder so they can't pee, but mostly they're painful and likely to foster infection. And getting rid of a bladder stone is fairly easy, either through surgery or if it's really small, sometimes diet. Getting rid of a stone in the kidney, much bigger deal. Cutting into the kidney is not fun, not necessarily indicated. We may just manage them. A stone in the ureter is bad news because this is such a small tube. It's passing a stone from the kidney to the bladder and gets stuck. The kidney blows up with back pressure sometimes and you can lose a kidney to that. So that's a case where if we think that's going on, you might do the MRI or the CT or whatever to see whether we need to do surgery or what. Yeah. So. Okay, so what causes stones? What are stones made of? Calcium? Usually calcium carbonate and sometimes calcium oxalate. Those are the common ones in rabbits, a few others. So how does calcium carbonate get into the urine? Food. It's normal. It's normal. Is calcium carbonate normal in our urine? No, not. In rabbits, yes. All the excess calcium we take into our bodies deal with calcium differently. When you're eating something, your gut senses the amount of calcium you need in your body, and if you need some, it absorbs some. If you don't need it, it doesn't absorb very much. So humans just take in the calcium they need. If there's any excess, it goes out in the feces, through the bile. So we don't have a lot of excess calcium floating around. Rabbits were apparently evolved in a calcium-poor environment. They take in every bit of calcium they can from anywhere and absorb it. So they have high levels of calcium in the bloodstream and they need to get rid of them, and they do it through the kidney. So do horses. So what does that mean? Normal rabbit urine has a chalky, milky appearance to it. Not abnormal. I do get calls from people or people bring samples that bunny peed, it was a nice yellow pee spot, and then it dried up and there's all this sand. Okay, no problem. That calcium went in through the mouth, into the bloodstream, out through the kidneys is not a problem. The stuff that gets stuck inside that's going to be a problem. So, what is sludge? Anybody tell me what sludge is? Calcium? Calcium where? In the bladder? Yep. But we just said calcium is normal in the bladder. What's different about sludge? Exits. Okay, good. So you have this nice, creamy looking yellow urine. If you let it sit in a cup, the calcium all settles to the bottom and you get a layer of sand and then a layer of clear urine. If that happens in here, the bunny can let all the calcium settle down to the bottom and pee, and only the clear urine comes out. So you get more and more and more sand built up. And we call that sludgy urine. When it comes out, it looks like what? Crystals? Worse than that. Looks like toothpaste. Real sludgy urine sits up in a mound. It's like almost like diluted clay. So that's not right, and is usually accompanied by discomfort and straining and that kind of thing. Sometimes the cause of urine dribbling is sludge in the bladder, and what's happened there is the bunny knows his bladder's full, it's full of sand, and he tries to pee, and all that comes out is the little urine because either his sphincter isn't working, or he had an infection that it increased the thickness of the wall, or something prevented that from happening. So now he has all this sludge and he keeps trying to pee because he knows his bladder's full, but nothing comes out except a few drops, and it just dribbles all the time. So sludge is any ideas about causes of sludge? I'll give you some, but right?
I've read a lot about certain foods.
Certain foods?
Spinach, alfalfa, I don't remember what else, but...
Okay. So one obvious cause of sludge in the bladder is calcium intake. Taking too much calcium, you're at more risk for sludge. But not every rabbit that's fed all alfalfa hay, all alfalfa pellets will get sludge. You put a whole rabbitry like that on that diet, and maybe one or two get it and the rest don't. So what's the deal? There has to be some individual variation there in how they handle it. The rabbit with a weak muscle, either he's old, or maybe he had an infection, or maybe he has echinoculi and his nervous system doesn't work too well. So the rabbit that doesn't fully empty his bladder is going to be at risk for creating sludge because it'll sit there, the sediment comes out, and then it gets thicker. Same for the rabbit who has arthritis. I don't know whether you've ever had a leg injury or something, but I have, sitting at home, and you think, I really need to get up and go use the restroom, but it's a pain, I'm going to wait 5 minutes. I'm going to wait 10 minutes. No, I'll wait a half an hour. Well, yeah, I guess I really got to go now. Okay, the rabbit who's arthritic is lying over there, his litter box is over here, and he's thinking, I should pee, but I'll wait a bit. It's hard, I'm going to wait. So he finally gets up and goes, but by then maybe all the sediment is settling out there, so musculoskeletal stuff can do it too. So sometimes treating for arthritis is part of treating for sludge. Lowering the calcium in the diet makes good sense, and it doesn't work. I find what really works is diluting the urine, more water to resuspend that sludge. So getting them to take in a good amount of water. How can you get rabbits to take in more fluid, more water? Add juice, okay. If he scorns his water dish, maybe he'll drink water with a little bit of juice added for flavor. Juice has sugar, so it's a balancing act. But for this particular bunny, if he'll drink a cup of juice water, then go for it. Anything else?
Sub-Q fluids?
Sub-Q fluids. If you really need to make an animal increase their fluid intake, you can get fluids by injection under the surface. I would do that in a heartbeat in an acute situation. I'd like to find a different solution for long-term management. Yes, greens. Greens are 70% water. So a cup of greens is 3/4 of a cup of water. That's great. Do that. Greens and feed them wet. So you can syringe feed water or really thin critical care if your bunny's up for that. If we're looking for long term, you'll probably get tired of that over time, unless they really, really like it. If they really, really like it, you can give them a couple syringefuls a day. So diluting the urine helps. And that's my major strategy. I also do avoid the really high calcium foods, alfalfa, spinach, and sometimes kale. Kale could be limited, but I think that most vegetables, even the ones that are high in calcium, carry enough water with them that they outweigh the risk. So lots of veggies, lots of moisture, and cure any underlying problem like E. cuniculi, like a bladder infection, like arthritis. What about just urine soiling? That's a tough one. There's two terms that I use, and I don't know if there's any agreement, but I use two terms. One is urine scald, and one is the other is urine soiling. Urine soiling, to me, affects the hair. The hair is kind of cruddy, and there may be dried urine on it. But if you part the hair and look, the skin is happy. So that's urine soiling. You don't want it, but it's not a disaster. On this side, we have urine scald. You part the hair, and the skin is red, inflamed. It's the rabbit equivalent of diaper rash. Yeah? So urine soiling is a problem. Again, what, where, and what's the cause? So the what is inflamed, red, soiled skin. The where is not so clear. Where did the problem come from? Did it come from the bladder because there's a bladder infection and you have infected urine? Did it come from the bladder because there's sludge and he's dribbling all the time? Did it come from the muscular system because he won't posture? He just sits and pees and sits in it. Did it come from his environment? We all have seen rabbits in shelters who are just messy on the rear. That's because their litter box is a half an inch deep in pee. They have nowhere else to go, they sit in it. So the where, you have to find out why this rabbit is scalding, and then we deal with that. Cause could be arthritis. It could be infection in the urine. It could be neurological, like E. cuniculi. It could be environmental, poor husbandry. Okay. So, anything else? Any other questions? Any other urinary problems you'd like to look at? Yeah. Good question. We come back to urine color because that's so important. Something you can watch at home. What is the normal color for urine? I would say average normal is yellow, but range of normal is great. It can range from yellow to light orange to dark red orange, and that can all be normal plant pigments coming out in the urine. It should not be, it should not have blood clots in it. That's not normal, okay? So any of those is normal. If you see the dark orange reddish urine and you don't know if there's blood there, do two things. One is look at the rabbit. Is he totally normal? Hopping around, eating, playing, then less likely to be blood. You can relax a little bit, but let's get it checked out. If he's sitting in the corner straining or just all puffed up, maybe there is something going on. That one you get in now. The other one, you try to collect some of the urine, or you make an appointment for next week and you just have it checked out to be sure. If you can get a sample of the urine, we can do a quick dipstick test and say it's blood or it's not blood. So that's red, orange, orangey, yellow, really, really pale dilute, so almost clear, is not average again. Could be normal if they just like to drink a lot. If they're on a really high fluid diet, they could have very pale urine, it could be normal. How about purple? Seen it twice. Beets. The first time I saw it, I sat there and went, oh my God, I don't know what that is. Oh my God. I said, could it be the beets he ate? Yeah, all right, beets. So we don't panic, but we pay attention to that. Anything else? Urinary tract questions? Yes.
I have a buddy with high-end problems that's going to have to wear diapers, except I have no idea how to do that. So can you talk about how often and how to do that?
There is a companion piece to this talk that's going to be on the Rabbit Haven website, where Marinelle Harriman, who started this whole House Rabbit Society deal thing, talks about your role in home care, and I think she will cover diapering. There's also an excellent DVD from House Rabbit called Living with Disabled Rabbits, I think, that gives you step-by-step how to do this. Briefly, you use the size appropriate for the rabbit, which is either newborn or preemie, and I was always taught to put it on back to front. So instead of the tabs go back there. Cut a hole for the tail, because that anchors the whole thing. Pull the tail through. So you just use the blade of the scissors to make a little stab, pull the tail out. And then you have to cut a little hole, a little slit in the front so their legs can move. So you're basically just adapting it to a rabbit shape. The deal with diapers is, if your rabbit is really mobile, they'll swim out of them, usually. If they're not really mobile, then it works great, and they have to be changed frequently. They will absorb, but they won't absorb forever. So Marinelle recommends 3 times a day if you're going to do that. Yeah?
Did you say back to front or front to back?
Did I say back to front or front to back? Isn't it the same, or is it not? I want the opening back here. Okay? Yeah. Yes?
This is not really urinary per se. A lot of times when you go to the vet, they'll draw urine and do tests on it.
Mm-hmm.
What are they looking for?
Okay. What do we look for when we do tests on urine? Many things. The typical little dipstick that we get tells us the acidity of the urine. And you guys probably know we measure acidity in pH units. 7 is neutral. It's neither acid nor basic. Do you know where normal rabbit urine falls? Basic or acidic? It's very, very basic. Almost all herbivores have basic urine, so their pH is 8 or 9, not 7. So if the pH is lower than that, it can mean that you have a severe metabolic problem, that you're wasting, that you have acidosis or something like that. So pH, glucose is on the strip. You have a lot of glucose in your urine, something's going on. A little bit can be a stressed rabbit, a lot could be diabetes or other severe disease. There's blood on there. So the dipstick says it has no blood, small amount, trace, large. Bilirubin is on there. If you have a severe liver problem and you have bilirubin in your urine, that's on our dipstick. So what else? Then if you're doing a complete urinalysis, they'll take the urine and spin it down and look at the sediment, and you see a ton of crystals because it's a rabbit. That's totally normal. But you also may see red blood cells, white blood cells, or bacteria, or even abnormal cells if there's a tumor. Yeah? Oh, concentration, that's the last thing. We have something that measures the concentration of the urine. So that can tell you about kidney function, about how hydrated they are, about whether this rabbit that had sludge before is drinking enough to prevent sludge. Anything else? Yeah. Sometimes the rabbit will pee outside of the box. Bad bunny, okay. Sometimes it looks just yellow, normal. Sometimes there's white in it. Anybody else got to guess what the white is? Calcium carbonate crystals, totally normal, as long as it's not accompanied by straining or a thick wad of sludge. So that's normal, that's not sludge. That's rabbits. Brownish color urine. Probably, again, not average, but often normal. It could be digested blood, but I also noticed that I've seen rabbits pee and it's normal yellow color, and I come back 5 minutes later and it looks orange or brown. So that's oxidation by the atmosphere, so that doesn't count. That's okay. Okay. Big prize. What? What are the options for what? Anything that's going wrong with the urinary tract. So give me some examples. What could be a what in the urinary tract? What is the problem?
Infection.
Stone, infection, diet. Those are causes. I'm looking for a what is straining to pee. What is the problem I'm looking at? Why is he straining to pee? Why is he peeing all over? Why is he scalding? Why is there blood in the urine? Why is he painful? Those are all whats. And where? Kidney, ureter, bladder, urethra. Or to make it easier, kidney, tube, bladder, tube. And causes, the things you just mentioned, what can cause urinary problems? So things we associate with the urinary tract, like kidney failure, like a tumor in the kidney or the bladder, a stone in the kidney or the bladder, infection in the kidney or the bladder, crystals, and then things we don't associate with the urinary tract, arthritis, sore back, overweight, poor management, neurological problems like ecuniculi and other things, disc disease. All those things can make it look like, can cause a urinary problem, but they're not in the urinary tract. Yeah. How do rabbits do with one kidney? You can ask my 11-year-old rabbit who has one kidney. He's doing great. Yeah. And he actually was a good example of this. He had a persistent runny eye, and I put some drops in, and I looked at it, I wasn't getting any better. I said, I need to take him in the clinic and flush that eye, make sure what's going on. So I took him in the clinic, and I thought, oh, well, it's been a while, I should do a physical exam. And I put my hands on him, and his right kidney was 4 times the size of his left kidney. So I went, okay, forget the eye, we have an issue here. The what is one huge kidney. The where is one huge kidney, and the cause is, I had no idea. So then we went to the imaging, which showed that the outflow from that kidney was blocked. It was blocked by a tumor that wrapped around the urethra and a second tumor in the kidney. It's like, whew, okay. And by the way, his other adrenal gland was big. So he went up to UC Davis, and they did a super job. I agreed to have him take out that kidney. And they said that other enlarged adrenal, that's why he's humping his mate all the time. Isn't that annoying? And I said, yes. And I know it could be a tumor, but he's 10 years old. And they said, could we take out the adrenal? And I said, it's a big operation. Just do the kidney. They said, oh, please, if it goes well, can we please take out the adrenal? And I said, oh, all right. And they did, and everything was super. 15 minutes on one side and 30 minutes on the other side, and then we have to look back. So that was a good outcome. Anything else? Okay, so I think we're done with that. We can have some drinks and then have fun with our own urinary tracts, huh? Any other?